Essential daily penis care for older men. Boost comfort, hygiene, and sexual wellness. Welcome. Today, we're diving into a topic that doesn't get nearly enough attention, but absolutely should. Daily penis care for older men. Whether you're in your 50s, 60s, 70s, or beyond, maintaining good penile health is essential, not just for hygiene, but for your overall comfort, confidence, and sexual wellness. Let's be honest. The body changes with age. That includes the penis, the surrounding skin, and your hormonal profile. But here's the good news. With consistent, mindful care, you can maintain not just function, but also comfort and a sense of control over your intimate health. We're going to break it down into several key areas: hygiene, skincare, erectile health, urinary wellness, and preventive habits. Hygiene. Keep it clean, but be gentle daily. Hygiene is the foundation. But many men, especially as they age, either get too aggressive with cleansing or not thorough enough. Use mild, fragrance-free soap. Harsh soaps can strip natural oils and irritate delicate skin. Look for gentle cleansers designed for sensitive skin. Avoid antibacterial soaps. They often do more harm than good. Warm water, not hot. Too much heat can dry out the skin, especially in a sensitive area like the genitals. Gently clean the entire area, including the shaft, base, scrotum, and especially under the foreskin if you're uncircumcised. Pull back the foreskin carefully and rinse thoroughly to prevent the buildup of smegma, which can cause irritation or infection. Dry completely. Moisture creates a breeding ground for bacteria and fungi. Pat dry, don't rub with a soft towel. Make sure the folds of skin are dry, especially around the scrotum and under the foreskin. Skin care. Hydration and monitoring. The skin around the penis becomes thinner and more fragile with age. It's more prone to dryness, chafing, and irritation. Apply a moisturizer daily. Choose one that's unscented and free of alcohols. Look for natural oils like coconut or jojoba, or use a product designed for intimate skin. Apply after showering to lock in moisture. Check for changes. Be proactive. Look for red patches, bumps, sores, or areas of unusual texture. These can be early signs of irritation, infections, or, in rare cases, penile cancer. If you notice anything unusual that doesn't go away in a few days, speak to your doctor or urologist. Combat chafing. If you're active or wear tight-fitting clothes, consider a barrier balm or powder to reduce friction. This is especially important if you're exercising or in warm weather. Erectile health, circulation, and hormonal support. Erectile health is about much more than just performance. It's a signal of cardiovascular and hormonal health. Stay physically active. Moderate daily exercise, like walking, stretching, or light cardio, improves circulation, reduces inflammation, and supports healthy testosterone levels. Eat heart-healthy foods. The same foods that protect your heart, like leafy greens, fatty, fish, nuts, and berries, also support penile blood flow. Poor circulation is a major contributor to erectile dysfunction. Manage stress. Chronic stress leads to hormonal imbalances and poor libido. Consider relaxation techniques like breathing exercises, meditation, or even just regular downtime. Talk to your doctor about testosterone. Declining testosterone is normal, but if you're experiencing persistent fatigue, low libido, or mood changes, you may benefit from testing and possibly treatment. Don't self-medicate with ED pills. Always consult a physician. Erectile dysfunction medications can interact with other prescriptions, especially heart medications. Urinary wellness, flow, comfort, and control. As men age, prostate health becomes more important, and that can affect urination patterns. Monitor urinary habits. Pay attention to your flow. If you notice difficulty starting, weak stream, or increased frequency, especially at night, it may be a sign of an enlarged prostate. Pelvic floor exercises. Kegels aren't just for women. Strengthening your pelvic floor can improve urinary control and even enhance erection quality. Aim for 10-15 contractions, holding each for 5 seconds, twice a day. Stay hydrated, but smartly. Drink enough water, but taper off in the evening to avoid nighttime trips to the bathroom. Limit bladder irritants. Caffeine, alcohol, spicy foods, and acidic fruits can all irritate the bladder lining and contribute to urgency or discomfort. Preventive habits and intimacy. Maintenance. Lastly, let's talk about maintaining a healthy sexual identity and preventing long-term issues. Stay sexually active. Regular erections help keep the tissue in the penis oxygenated and functioning properly. That doesn't always mean intercourse. Self-stimulation or even nocturnal erections can contribute to health. Open communication with partners. Emotional and sexual connection can shift over time. Stay connected through open conversation, even if your physical intimacy changes. Use protection if needed. STI risks don't disappear with age. If you're with new or multiple partners, don't skip protection or routine screening. Keep up with checkups, annual physicals, prostate exams, and basic blood work are essential. Urologists aren't just for emergencies. They can help you stay ahead of issues before they become serious. Managing dryness, irritation, and itching. Dryness and irritation are common complaints for older men, especially in drier climates, after certain medications or due to age-related skin thinning. Daily moisturizing is key, but so is identifying and eliminating the source of the irritation. Synthetic fabrics, harsh detergents, and prolonged dampness from sweating can all aggravate the skin. Choose breathable cotton underwear and wash clothes in fragrance-free hypoallergenic detergent. If you sweat heavily during the day or after workouts, consider changing underwear midday to stay dry and reduce the risk of fungal overgrowth or dermatitis. Avoid overwashing or using multiple products. Sometimes less is more. Washing once per day is usually enough unless you've been heavily active. For any persistent itching or red patches, don't assume it's nothing. See a dermatologist or urologist to rule out eczema, psoriasis, or a yeast infection. Sexual sensitivity and pleasure. Maintenance aging may naturally reduce sensitivity in the penis due to changes in nerve function and blood flow. This can lead to delayed orgasm, reduced pleasure, or even emotional detachment from sexual activity. To stay connected with pleasure, take more time during foreplay or stimulation. Slower, more mindful sexual activity can actually enhance sensitivity and connection. Experiment with different types of touch, rhythm, and pressure. Try intimacy aids, such as lubricants, especially water-based or silicone-based varieties designed for sensitive skin. Dry friction can worsen sensitivity issues and cause micro-tears in aging skin. Avoid desensitizing products unless medically prescribed, as they can mask more serious issues. Focus on strengthening the mind-body connection through techniques like mindfulness, gentle massage, or even guided sexual therapy when needed. The role of sleep and recovery in penile. Poor sleep has a direct impact on testosterone levels, sexual function, and energy. Older men often suffer from sleep disruptions due to medical conditions, medications, or hormonal changes. Strive for 7 to 8 hours of quality sleep each night. Deep sleep is when the body repairs itself, and that includes the endocrine system. Lack of sleep leads to a sharp drop in testosterone and reduced libido. Use nighttime routines to improve sleep hygiene. Avoid screens before bed. Eat your last meal a few hours before sleeping, and reduce caffeine intake after mid-afternoon. Erections during sleep, especially REM sleep, are an important part of penile health. If you're no longer experiencing nighttime or morning erections, this could be an early indicator of vascular or hormonal issues. Keep an informal mental note of these changes and bring them up during routine checkups. Lubrication and friction management. During intimacy, as the body produces less natural lubrication with age, managing friction becomes even more important, not only for comfort but to avoid skin tears and infection. Use a high-quality, body-safe lubricant even if you didn't need one before. Choose products free of alcohols, parabens, and artificial fragrances. Water-based lubricants are generally safest for use with condoms, while silicone-based lubricants last longer and are better for extended intimacy. Don't ignore discomfort during intercourse or masturbation. Pain, burning, or rawness are signs you may need more lubrication, more foreplay, or to adjust your technique. Also, keep in mind that the use of some medications, like antihistamines, antidepressants, or certain heart drugs, can dry out mucus, membranes, and reduce natural lubrication. If you suspect a side effect is impacting your intimacy, bring it up with your doctor. There are often alternatives. 10. Emotional and psychological aspects of aging and sexual health. Your psychological relationship with your penis, how you feel about your body, aging, and masculinity can deeply influence your health and intimacy. As bodies change with age, many men experience a shift in confidence or identity. It's normal to grieve some of the changes, but it's also important to embrace a new chapter that includes wisdom, adaptability, and emotional depth. Sex is not just about physical performance. Intimacy is also about trust, connection, touch, and communication. Cultivating emotional intimacy with a partner can actually improve physical arousal and sexual satisfaction. Don't hesitate to speak with a counselor or sex therapist who specializes in men's health and aging. These professionals can help you navigate everything from self-image and performance anxiety to changing relationship dynamics. Wrapping up daily penis care isn't about vanity. It's about wellness, longevity, and comfort. It's also about self-respect. Just like brushing your teeth or taking your vitamins, a few small steps each day can make a profound difference over time. Caring for your sexual health isn't something to be embarrassed about. It's something to be proud of. You deserve to feel confident and comfortable in your body at any age. Take charge, be consistent, and don't be afraid to ask for help or advice. Your health matters, every part of it. Thanks for listening, and take care of yourself. Finally, celebrate your sexual identity at every age. There's no expiration date on pleasure, connection, or sensuality. Being open to learning, adapting, and caring for yourself in this way is not just empowering, it's essential.